Well, welcome to this video. My name is John Watts. I'm an Alabama consumer protection attorney, and I have a friend of mine, Dr. Mitch Robertson, with us. And I've asked Dr. Robertson to be here because a lot of my clients, doctor, face financial troubles. And while I help them with the legal side, that sometimes spills over into relationships. And Dr. Mitch and I were introduced by a mutual friend, and so I've been very interested to get to know you, find out more about you. And so I asked Dr. Mitch Robertson to be here to do a few things. Tell us what you do, a little bit about yourself, how you got into this line of work, and what is the process? In other words, when somebody comes to you for help, what does that look like? And then how do people find the right counselor, therapist, whoever they may need? And then we'll end it with, how do people get in touch with you if they want to know more about it? So I appreciate you being here, and you ready to get started?
Yeah, thank you, John, for inviting me here. I'm Dr. Mitch Robertson. I'm a licensed clinical social worker and also have a doctorate in family therapy. I chose a school that had a ministry background. I wanted to have a background so I could talk to people about the spiritual aspects of the issues that they're facing. The financial part spills into the marriage, where there's fussing over you spent too much, and so one of the approaches I take is trying to help people look and understand what the money means to them. One of the therapy techniques I use is through the Gottman Institute, Dr. John, Dr. Julia Gottman, and they have what they call a dream within the conflict. In the first part of it is not to resolve the issues, to help understand. For example, it's money. What does it mean if you're overspending? And some people may say, well, I'm trying to spend all this money so I can have things for my family and for my children and grandchildren. And the other spouse may be trying to hold on to everything because of their experiences in life. They know what it's like not to have money, so there's that fear. But helping both of them understand so they stop the gridlock issues, begin to respect each other's positions. And there are couples who have been married 50, 60 years that have disagreed on a topic of their marriage.
That's a long time.
A long time. And I give the example sometimes of James Carville and Madeline Martin. Miss Martin's a Republican strategist. She was a strategist for George Bush Sr. Carville was a Democrat strategist for Bill Clinton. They will probably never agree on the politics, but yet they have children in their 20s and 30s and somehow made that relationship work. And I think that's with finances or any other issues, try to look, what do we have in common, what's most important to us.
Okay. So give us kind of a quick overview of what exactly do you do as far as helping folks?
I work in several different areas. One of the areas I like is, and studied in school, is loss and grief. And part of that interest grew out of my experience. My dad died when I was a teenager, so I know what it's like to lose someone. I don't know what it's like for someone else, that I don't know how they feel. They only know how they feel when they tell me. And so I wanted to learn how to help people work through the process of grieving. What I learned that you grieve over different things, where it's finances. There may be a financial loss, there may be a divorce, there may be a job loss or a move or even a promotion, because you may be getting something you've wanted but leaving some people behind. Okay. So those type losses. In marriages, look at the betrayal of trust. That's a loss. Lost in the trust in that individual that you had trusted for years. So look at that part. The other area that I like a lot, I guess, enjoy, is couples therapy, and I went back to school after getting my doctorate to study with Dr. John and Dr. Julia Gottman. And Dr. Gottman uses research. He put people in he called it a love lab. And he put for a lack of a better term, he called it a jingle meter. So if you moved in your chairs, he was talking to the couple that would register, and he would check the pulse rate, he'd check the put sensors on their face so that if they got tensed, he videotape, audio tape, so that he could look, okay, here's what the issues are. How can we develop interventions that will keep families together? And so, and that's the approach I take. I want to help these families work out the issues and be able to stay together.
Okay. So I should have started with this, but let's back up a little bit and tell us a little bit about you. Are you married, kids, where do you live, that type of thing?
I'm married. I have 4 children, a daughter and 3 sons. My oldest son is in, he just leaving San Diego. He and his wife are moving to Pensacola. He's a flight instructor with the Marine Corps.
Okay.
We have a middle son that's in Huntsville, younger son in Athens, and a daughter in Florence. So come spread around. And so from my own study, my wife's a therapist, and we both studied with the Gottman method. So we learned that part, and we both studied the Parent Project in California to help parents deal with difficult children. And so those are some of the things that, trying to help families work through issues and be able to stay together.
Okay. So from just getting to know you over the, I guess, several months we've known each other, I think you had sort of a first career, and then this is a follow-up career. So tell us about that.
I was a social worker for the state of Alabama for several years. I retired from Alabama Public Health. I worked with their Plan First program, which helped women who wanted to control or decide when they wanted to have children, and a Patient First program helping to make sure that children were able to get to the doctors. Sometimes the doctors, my role at that time, they'd call me and say, so-and-so didn't show up for the appointment. And it might be that they didn't have gas for the vehicle, or other issues come up, and mine was to help them resolve those so they would keep their medical appointments.
Okay.
And I enjoyed that type of work. I had wanted to do some private counseling, and so this provided an opportunity to continue my education, get the license, and do private counseling.
And where do you primarily, I don't know what the right word is, work in or draw your clients from? Is it, we're filming this in Madison, where my office is, city of Madison. Is it mainly in Madison County, or is it Limestone County? Because I think you live in Athens, right?
Live in Athens.
Okay. So where do you draw your clients from?
From several different areas. I get some people from Jackson County and some from other places that, that they will be referred by insurance. I take Blue Cross and TRICARE and some of the others. TRICARE sends referrals. And then I get referrals from ministers where, I've done some workshop in churches, and they will send mainly couples therapy there, that they'll send couples that need therapy.
And I don't know what the answer is. That's why most of these questions, I don't know the answer, is why I'm asking you. But if you look at all your clients, would the majority be what I would call marriage therapy, or is it couples therapy?
It's sort of a mixture. I have clients that may have addiction issues, clients that have marital issues. Sometimes the addiction issues spill into the marriage and cause marital issues. Okay. And then work with depression and anxiety and those type things. One of the techniques that they found successful with anxiety and depression is EMDR, eye movement desensitization and reprocessing. They've used it with the military, with people going to deployments, coming back from deployments, post-traumatic stress. And so that's, I'm thankful to have that resource to assist people. I also recommend to clients things they can do at home. Meditation, journal. I've been journaling for 20-something years, almost every day.
Do you do that
with
physical paper?
Yeah, physical paper. And there's something about the process of writing it down. About 24 or 5 years ago, I went through a spiritual journey. I wanted to grow spiritually. And I went through this 12-step program, same 12 steps that they use in AA and NA.
Okay.
They take the steps from the Bible, from the Scripture, and what I saw was it allowed me to take the Scriptures and apply it to my life. one of the things, I guess it stood out in the 12 steps, is said you cannot have spiritual growth and resentments at the same time. You have to hold on to one and let go of the other. And probably many of the people come see me were like, oh, it's hard sometimes to let go of those resentments. And that's where the spiritual part comes in with forgiveness. And I learned that forgiveness is not to let the other person off the hook. The forgiveness is to let me off the hook. So that's one of the approaches that I work with the people that come to see me that have sort of a spiritual background or base, because it works. It works.
Well, and so let's talk a little bit about what I'm going to call, you may call it something else, but just the process. So somebody starts here, they contact a therapist, and let's use you, because we're chatting with you. So they talk with you, and just walk us through, and I know it's probably different for everybody, but what's the typical process? Is this do you do it by phone? Do you do the therapy sessions in person? Is it one time, more than one time? Kind of how does all that work?
They usually will call my office and set up an appointment. There's paperwork that they fill out for us, so we have an idea of some of the issues they're facing. If they have insurance, they list that, so we can get approval from the insurance. If they don't have insurance, look at the amount that to be charged.
So insurance does pay for this?
Just pay for most of it. Usually there's a copay with all of the insurance companies. And then we have them to tell me in their own words what the issue is. One of the sort of catchphrases that therapists use a lot is, what brings you here?
I may start using that. What brings you to see me?
Yeah, and so then, they tell us, this and this and this. I'm divorced, I've had it up to here with my spouse, I don't want to be married anymore, or whatever's going on. So we look at that, then we look at setting up a treatment plan. Here's what you're saying the issues are, here's some possibilities. And because I use the Gottman approach, have them to recommend that they take some assessments. And they can do that online. The Gottman Institute sends it to me. And then I'm able to sit down with a couple and say, okay, according to what you put on the paper, here's some additional issues.
So is that assessment, is that personality or emotional, or what is it?
It looks at the emotions, looks at finance. It'll ask questions, has there been any pushing and shoving in a relationship? Has there been substance use or abuse? It'll ask about the physical relationship, the emotional relationship. And the theory with the Gottman's approach is that if one person has an issue, the marriage has an issue. So we address those. And then we look at interventions that we can use to help them.
And let me ask you this, because you mentioned physical and emotional and financial. I'm assuming you get pretty personal here, pretty detailed. Everything that's discussed, is that confidential?
It is. Well, with a couple of exceptions. If it's about child abuse or child neglect, I'm a mandated reporter. If somebody says I'm going to hurt someone else, right, I'm mandated. Or if they say they're going to hurt themselves, as a therapist, I want to do what I can to protect them from themselves.
Okay, so that's similar to us. Somebody comes in, that's attorney-client privilege. Now, if they say, I've got a trunk load full of guns, but yeah, people can share their very personal information with us, knowing that it's not going to leave. Now, kind of related to that, do you sometimes just meet with one spouse? Do you sometimes meet with both? Do you prefer to meet with both?
The approach that the Gottmans have outlined is I would have separate interviews.
Okay.
Husband, then wife, or 2 or 3 interviews, so you can get their individual perspective. Bring them together and then talk about the issues.
Okay. And what about, we're talking about, again, what I would call marriage counseling. I don't know if that's the right word, but do you ever meet with couples before they get married?
Yes,
Okay.
and try to help them and look at things such as expectations. What are you expecting? Because sometimes they're unspoken expectations, and we'll get married and find out.
Well, everybody should know what my unspoken
that's right. Yeah,
expectations.
and for example, a woman may have grown up where she worked outside with her dad, and so she likes outside work, and husband's expecting her to be inside, or the husband, his wife's expecting the husband to be outside working. Well, he grew up where he did the things inside the house. He liked washing the clothes and doing some cooking and those type things. And it's not a right or wrong, good or bad. It's just, this is where I'm coming from.
Probably need to get on the same page.
Get on the same
right?
page.
Okay.
And so and then there couples come in with issues about children, and it's a matter of getting on the same page. In the Parent Project, one of their key ideas is that it's better to have a weak plan that both partners agree upon than a strong plan that only one, because the children can play parents against each other, but they just say, we've discussed this, your dad and I, or your mom and I, and this is what we're agreeing upon.
So rather than you ask mom and then you go ask dad.
Yeah.
Okay, I got you. And so, we've talked a little bit about that process, and somebody may be watching this saying, I need some marriage counseling, or have an issue with my child, or maybe I'm dealing with some difficulty. How do I find the right therapist? Do I go to my doctor? Do I Google it? How do I find the right person? And I don't mean how do I find the right name, but what questions do I need to ask to determine, okay, this is the right person for me?
Some of the questions that I've been asked is, have you addressed an issue like mine?
So they're not the guinea pig, right?
Yeah, so not the guinea pig. And that sometimes I think when we have issues, we think we're the only ones in the world that have that issue. And so being able to comment that, but I think finding someone that you feel comfortable in talking with, that you trust, that they're going to keep your secrets and protect your secrets. And I think that's part. And in talking, probably the first interview, you get some idea about the rapport between the two.
Are there certifications, organizations, designations that people can look for? And then I have a follow-up question I'm going to ask you about. Is there a difference between a therapist and a counselor? But maybe are there some organizations they need to look to see, is this therapist a part of that? The
Alabama Social Work Conference has list in the National Association of Social Workers. Alabama Counseling Association lists counselors. To most in Alabama, you have to be a licensed either social worker or counselor to provide service. As a social worker, I had to get my license as a licensed clinical social worker, LCSW, and then the PIP, private independent practice. And you need continuing education credits each year.
Okay.
And they're 50-something just for the license, if I remember correctly, and about 25 for the PIP. So they want you to continue your education.
These are hours of education.
Yeah, continuing education use. And that makes a difference. So therapists can stay on top of the new things coming out and be able to offer the best service to the person who comes to see you.
Well, I know, one area we work in is people who are facing a potential foreclosure, which, just from my non-counselor view, really puts a lot of stress on a marriage. But sometimes they go to a lawyer who knows how to do things from 10 years ago.
Yeah.
But the laws have changed, the way financing works has changed. So that makes sense to me. You'd want somebody that is staying on that cutting edge. Mm-hmm. And because it sounds like this, and I forgot, is it Dr.
Gottman?
Sounds like they use a lot of research-based rather than, well, I suppose, or I think. Yeah. It's, well, let's test this out.
And if and I've noticed since I've trained with him, when he finds something new to update, he sends that to us. This may have been correct 5 years ago. This has changed, so here's the approach and here's the intervention. I like that because you can see 50 people and have your theory, but this is research based, so that they can go back and see out of this pool of the research, we know that 98%, this works for 98%. And the Gottmans look at the 4 horsemen. They call the 4 horsemen criticism. That's one of the 4 horsemen. Defensiveness, contempt, and then stonewalling. With criticism, the complaint is, Mitch, you didn't take out the garbage. Criticism, you never take out the garbage, you're lazy, you're a slob, those type of things. Defensiveness is like, and instead of taking responsibility, my correspondent said, well, you didn't wash the dishes, so the argument continues, where the intervention with criticism would be soft startups and being respectful and with.
So what does that mean, a soft startup?
Well, the tone of voice, using I feel words. I feel disappointed, or I feel frustrated when I come home and the garbage that's not taken out. And the contempt, people roll their eyes or do a smirk or sarcasm, the put downs and stonewalling. Men do this more than women, where if the heart stonewalling, if the heart rate gets above 95 beats per minute, then it's just like we're not even processing. It's kind of, as they describe it, going over our head. And there's some exercise, to relax and calm down, get the heart rate down, so that people continue to call. One of the things I've shared with clients is humor works, in dealing with something. When my wife and I first married, I had worked late, didn't call and say, I'm working late. So when I got home, my wife said, Mitch, hold up your hand. So I did, and she said, can you do this? And I said, I did. Well, she said, I wonder why you didn't say, I'm going to be late. We both laughed. I got the message. I called, and so I share that with clients. You can do that in a way that allows you to see, okay, there needs to be some changes, and you do it in a respectful way. And that was the way I thought she did very well.
Was that before she was a trained therapist, or after?
No, after. and it worked well.
Well, very good.
I still have that message and learned that lesson.
Very good.
But those are some things I think, some couples think that the marriage is over, and it's, holding on to some of those resentments and being able to go back and look at these gridlock issues. They can be money, it can be the frequency of sex in a relationship, just a whole lot of different things that they call it that gridlock head-butting thing. But the good part about that, there's interventions that can help make it better.
Well, I'm going to ask you a question.
Okay.
If you cannot answer it, that's fine.
Okay.
But if you can, I think it'd be helpful to people sort of in my world that are watching this video. Because we deal so much with people who either are currently going through financial distress, or maybe they have in the past, and now that's coming back on them. Maybe they're being sued by a debt collector, called by a debt collector, or facing a foreclosure. Is there any just kind of general tips or advice for a married couple where they are facing some financial difficulty? Not to take the place of getting the right type of counseling or therapy, but are there just some tips maybe you could share with people to say this might get you down the right path?
I think in being able to talk about it instead of blaming, you did this and that if there's a financial issue or we're getting sued, the marriage is getting sued. If there's financial issues, the marriage has the financial issues. That together we can work on it. There's some programs in churches called Celebrate Recovery. So that's sort of a 12-step approach. I think that will be helpful. There are 12-step workbooks if they choose not to be a part of a group. So they can work the 12 steps. The 12 steps I went through had a spiritual base. It took showed the scripture in the Bible that the steps were taken from. So I would recommend that. I would recommend journaling, I'd recommend exercise, because exercise helps lift your mood and to make sure you're getting plenty of sleep. They've done some research studies that have found that you need at least 8 hours of sleep.
I must have missed that research study, because it seems like that kind of in our modern day life that's what we sort of shortchange is our sleep.
And you can tell a difference. This couple out of Auburn University did a study probably about 10 years ago. They were looking mainly at children, but what they found was that the children who did not get enough sleep, they would have symptoms of ADHD, bipolar, depression, and over about a 2-year period would gain weight. So that lack of sleep, affects all of us. My wife and I recently came back from San Diego, and we took an overnight flight.
Oh, like a red-eye flight.
A red-eye flight.
Those are brutal.
And we were both talking about, how that lack of sleep, it's hard to sleep like you'd be trying to sleep in this chair, when you're on an airplane. But that's one of the things I ask parents, how well are they sleeping? And what the couple from Auburn found, they included their own children in the research and put a little band on their wrist that computerized to measure how much sleep they were actually getting. Parents said, well, I put them to bed at 8 p.m.
Oh, okay.
And which was correct, that a true statement, but they'd find through the computer readouts they might not go to sleep till 11:30 or later. And so then they would get up in the morning and it'd be hard to get them up and they'd be grouchy and all of those things. So those are some things I think couples can work on. Doing the journaling, writing down those feelings, paying attention to the resentments, because the resentments can get where, the couple don't want to talk to each other, because you can get into blaming. And to resolve the issue, you have to look at a more positive approach. One of my friends that I was in Toastmasters with several years ago, he said you cannot get positive results with negative thinking. So, if couples come in, if they want to change things around, then they have to look at it in a more positive way. And I think, as I mentioned earlier, to look at it, it's our problem. It's the marriage problem. It's not your problem or yours.
Because I have seen that where maybe the wife is sued and the husband says, well, I'm not sued. That's her problem.
Yeah.
Well, you're supposed to be together.
That's right. That's right.
And a lot of times with foreclosures, what we see is one person is responsible for paying the bill. Something happens and they start to fall behind, but there's not that communication. So they say, I'm going to fix this. Further and further behind, and then the other person who doesn't pay the bills suddenly gets a letter saying you're being foreclosed. And now there's all this anger, and so maybe I need to send them to you. But if somebody does want to get in touch with you, and we'll put on the screen, website and things like that. But what would be the best way? Do they need to go through a doctor to get to you, or a minister, or can they contact you directly?
They can go through their minister or through the websites or physician, or call me directly. My office number is 534-8161. My cell phone number is 256-874-4159. And our office number is 256. I realize I didn't say that.
Yeah. Well, that'll be good. And we'll put, I think your website maybe is under construction.
Under construction. And my email is Robertson, Robertson, Mitch, MITCH, 2002 @yahoo.com.
Okay.
So that's another way to.
Okay. Well, we'll put all your contact information, and I'm sure there's 100 things we've left out. Is there anything that you think would be helpful that we didn't cover?
Okay, just for the people who are watching this, that all of us have issues in our life, and it's good to find someone to talk to, whether you're talking to your minister or best friend or talking to a licensed therapist. That's important that you talk to someone and have someone to share with.
Well, I'll share this with you. What I do is trial work, and one thing I've noticed about lawyers that do trial work where we're standing in front of juries is you'll go to your law partner or somebody else and you say, I need to pick your brain for just a minute.
Yeah.
What they really mean is, I want to talk out loud my thoughts and I need you to listen to me. And usually the person listening maybe makes one little suggestion and the other lawyer goes, oh man, so great talking to you. I really have some clarity on how to try this case. And I realized a number of years ago that we that do trial work, we do that, and I guess that's kind of what you're talking about, is just to be able to say it out loud to somebody.
That's right, and that's important. And sometimes when we hear it out loud, we think, that doesn't sound as bad. It sounds much different inside our head.
Right. Okay. Well, I think this has been very helpful. I appreciate you coming by. And again, for anybody watching this, we'll have the contact information for Dr. Robertson to be on the screen, or however I don't know technically how we do that, but we'll make it work somehow. And so if you think you maybe have some need for somebody like Dr. Robertson, like he said, getting, if I can say it this way, and you can correct me if I'm wrong, but getting therapy doesn't mean you're broken or anything.
That's
it just
right.
means
That's correct.
we need some help, just like we might go to the doctor, we might go to a financial advisor, might go to a lawyer, might go to a real estate broker. This is to go to somebody that has expertise.
That's correct.
Okay. Well, thanks for being here.
Well, thank you for inviting me.
Appreciate you sharing your knowledge.
Thanks.